Hey everyone, how's it going? Today we're talking about a super important topic that needs your full attention: the early signs of HIV in men. If you're sexually active, listen up, because some of these signs might go unnoticed. And knowing how to spot them early can make all the difference for your health. Have you ever experienced any of these symptoms without realizing it? Stay tuned, because in today's video, we'll break down 7 early signs your body might show when HIV is present, and what you should do if you notice any of them. Let's get started. Before we dive into the signs, it's important to understand: what exactly is HIV? It's a virus that attacks your immune system, weakening your body's defenses and leaving you more vulnerable to other infections. HIV can be transmitted through unprotected sexual contact, shared needles, and in rare cases, through bodily fluids like saliva or semen. Now here's the worrying part. Many men take too long to recognize the early signs of HIV, and that can be dangerous. Sometimes these symptoms feel like nothing more than a common cold or flu. So let's look at the main warning signals your body might give. 1. Persistent fever. The first sign you need to watch out for is a fever that just won't go away. This fever is often accompanied by other symptoms like body aches, a sore throat, and even chills. Fever is your body's way of responding to an infection, and in the case of HIV, it can last for several days or even weeks. This symptom usually occurs in the first few weeks after infection, known as the acute phase, when the virus is multiplying rapidly in your system. Many people might mistake this fever for the flu or a common cold, but if it persists and is paired with other symptoms like night sweats or skin rashes, it's worth investigating further. 2. Intense night sweats. Another common sign is excessive sweating at night. If you frequently wake up with your clothes or bed sheets soaked, even though the room temperature is comfortable, this could be a red flag. These night sweats are not the kind that happen due to regular heat. They are often intense, frequent, and persistent. The reason for this is that your body is responding to the HIV infection, generating a strong inflammatory response. If this symptom becomes recurring, especially if it's accompanied by extreme fatigue or a persistent fever, it's important not to ignore it. 3. Skin rashes and lesions. Red spots, blisters, or rashes may appear on your body, especially on the upper part, like the torso, face, and arms. These rashes can show up within the first few weeks after contracting HIV, and they may or may not itch. The skin often reflects what's happening inside the body, and the presence of these spots could indicate that your immune system is trying to fight off the virus. The severity of these rashes can vary, and in some cases they come and go quickly. If you notice any kind of skin rash that doesn't have an obvious cause, it's a good idea to seek medical advice. 4. Joint and muscle pain. Experiencing intense and unusual pain in your joints and muscles can be another warning sign. These pains are often mistaken for regular flu symptoms or everyday fatigue. However, if the pain is widespread and persists for an extended period, it's something you should pay close attention to. In the early stages of HIV infection, your body is under immense pressure trying to fight off the virus, which can result in these aches. Additionally, the pain might be localized in specific areas, such as your back or knees, making the symptom even harder to identify without further investigation. 5. Extreme fatigue and headaches. Feeling extremely tired and having constant headaches are symptoms that should not be ignored. If you notice that you're feeling exhausted all the time, even after a good night's sleep, or that you're struggling to focus, this could be a sign that something more serious is going on. The fatigue related to HIV can be very debilitating, affecting your daily activities and your overall quality of life. Additionally, persistent headaches that don't improve with regular medication might be an indication that your body is fighting off a viral infection. 6. Nausea, vomiting, and diarrhea. Digestive problems are common symptoms in many illnesses, but if you're dealing with nausea, vomiting, and diarrhea that won't improve over days or weeks, it's something that should be investigated. These symptoms can be linked to HIV, especially in the early stages of infection. They can cause dehydration and weight loss, since your body is struggling to cope with the infection. The impact on your digestive system can be quite severe, and when these symptoms persist, it's essential to seek medical help to understand the root cause. 7. Persistent dry cough. Lastly, there's the persistent dry cough. If you've been dealing with a cough that won't go away for weeks or even months and it doesn't respond to typical treatments, it's time to get checked out. This type of cough usually doesn't produce any mucus, which makes it harder to diagnose as a regular infection. It may also be accompanied by shortness of breath and, in some cases, chest pain. This symptom could be a sign that your immune system is weakened, allowing opportunistic infections to take advantage. If the cough persists, it's crucial to see a doctor and investigate the cause. These are the 7 most common early signs of HIV, but remember, not everyone experiences them the same way. If you've had any risky behavior, like unprotected sex or sharing needles, the best thing to do is get tested for HIV as soon as possible. Tests are quick, free, and 100% confidential, and the sooner you know, the sooner you can start treatment. Nowadays, with the right treatment, it's possible to live well with HIV. Don't wait. Your health should always come first. Did you find this content helpful? Then don't forget to hit the like button, subscribe to the channel, and ring the bell so you don't miss any of our health and wellness videos. Taking care of your health is our commitment. See you next time.